Paul, what are the key themes of innovation in healthcare?
Well, digital, obviously. Genomics, of course, as I cover in my book, The Fourth Wave, Digital Health. And I think consumers, too. So consumers are being empowered with these tools more and more. And so healthcare is obviously doing a lot of good in this area, too. So I think as they converge, those three vectors will really come together and create great things.
Nick, let's have your take on that.
Absolutely. I'm all in on digital health. So, and it's already happening in our pockets, right? You've got a phone, she's got a phone, we've got phones. Those phones are covered up in apps. Consumers already have the tools that we need. It's not like, back in the day when Paul and I were coming up, you had to go buy, very expensive, fancy equipment. That's all been consolidated now into something that's all on our phones. And, whether health systems or doctors or nurses or providers, they want to use this stuff. Maybe in old legacy systems, there was pushback. I mean, we have this kind of joke in the United States that doctors are still using fax machines when nobody else uses fax machines except doctors. Consumers, people, us, we've already got what we need. And so when doctors or hospitals aren't using technology, and you as a patient, you look at your doctor and go, why can't we use the cool stuff that we already have? Why are you making me use some old technology? Well, that's just not working anymore. I mean, we've already reached the tipping point where these old legacy procedures and techniques just they're not working, and nobody wants to put up with it. So.
Very good. So we've talked about drivers. What about the barriers, the hurdles?
Well, I think, how physicians and healthcare systems are reimbursed. In the U.S., we have three different healthcare systems. We have government-run, Medicare, and the Veterans Health. We also have private healthcare systems, and then we have mixed models like Kaiser Permanente. So I think the ones where perhaps the profit is not as much of a priority or not a priority at all, but it's more about the actual healthcare delivery, the outcomes, and basically improving the lives of patients. I think the barriers are a little bit less sometimes, but definitely in the private sector, where profit is important for corporations. I think that's a big barrier to innovation because they're looking at, well, how do I make money from this new innovation first, versus how does this help the patient? How does this decrease costs? Sometimes if they can look at the decrease in costs, but then they may say, well, we need to prove this out first. So we can't deploy it full scale until we do a pilot. Well, that pilot may not prove anything. And so they may not innovate at all. Or they may just get this thing called pilotitis, where they just keep doing pilot after pilot after pilot, and they never actually implement anything. So, it's a mixed model of barriers.
Yeah, in the U.S., one of the biggest barriers to innovation has been this thing called HIPAA, which has a great origin to protect your information, make it private, and that's all great. But when you fold in layers and layers of bureaucracy and government-controlled stuff, what HIPAA has done through the years has been really a baseball bat to bang a lot of entrepreneurs and startups over the head with, which we could have just said, look, the free flow of information is what we all want. People get concerned about privacy. I mean, think of the stuff you see people posting on Facebook. They post the most intimate, private things of their lives to share with the world, yet they can be very concerned about, I just need this information to share with my doctor. I need my doctor to be able to share that information with my other doctor. I want to share it with my family, with my care team. Again, I think, Paul, you alluded to some of the apps in your talk. Doctors were already using things that the hospital said, you can't use that because it's not HIPAA compliant. Well, guess what? Like I say, they're bringing in their iPhones. They're just saying, look, we got to use this. WhatsApp, right? Boom. Everywhere else in the world, doctors are using WhatsApp. In the U.S., a doctor can get fined for using WhatsApp. It's silly.
So let's talk about the viable route for implementation.
So the viable route for implementation I think it depends on what you're talking about. So when you look at the consumer side, the viable route is basically it's open. There's a lot of tools out there for consumers to adopt now. They can be empowered. Knowledge is perhaps one of the barriers. We see in the U.S. with direct-to-consumer, say, genetic testing, the FDA is making headway in clearing companies like 23andMe to provide disease risk testing for genetic conditions, for BRCA, breast cancer risk, also for Alzheimer's and other conditions. So that is without a physician being involved in the process. So that's one route. We also have the medical side, which is where healthcare systems can become perhaps one of the biggest opportunities is the disease prevention side. So in tandem with what consumers can do on their own, healthcare systems can potentially, instead of focusing on this disease care, maybe focus more on prevention, which is, I think I mentioned earlier, Kaiser Permanente. They're focused on preventing disease before it occurs, which I alluded to in my talk. The CDC says 86% of healthcare costs in the United States are due to chronic preventable diseases for the most part. So there are opportunities for these routes of innovation to happen, and on both sides, for healthcare, for consumers, and other stakeholders are getting involved, like policymakers. I mentioned the FDA has a digital health initiative in the United States, so they're working with the private sector as well. So I think it gets back to talking, with one another, and looking at the opportunities and proceeding as wisely as possible.
Yeah. So I'm just gonna go back to tools already exist, and I was lucky enough last year at HIMSS, when it was in Orlando last year, to get invited to an Apple super secret invite-only deal, and I was excited to get invited back to that event this year at HIMSS when it was in Vegas. And what Apple is rolling out in the U.S. is everything that we've been talking about for the last 30 years. It's interoperability, it's patient experience, it's everything happening on Apple devices. Already rolled out in a dozen hospitals in the U.S. And basically, if you're an Apple user now, there's the health button. This is going to have the ability to, you hit that button and it geolocates an Apple partnered hospital around you. And what I've been telling my friends in the U.S., if you have to go to a hospital, go to one that's partnered with Apple. It's that simple. That's one
You're an evangelist of human-to-human interaction to push innovation too, right?
Absolutely. I mean, that's the whole, when you heard me speak earlier today about the Pink Socks movement, that's really the heart of this, is the ability to connect with people. It doesn't really matter what kind of technology we invent or scale up or throw money at. If we fail to do what we're doing right here, see each other, have a connection, it's all missed. And so what has to happen in the technology is there has to be what I like to call digital empathy. We have to feel that this technology is with us. And the people that are being successful with those technologies, like Apple and lots of others, are the ones that are winning.